This recorded review will be going over MedSurg 2, Exam 7, Study Outline. There are 7 Select All That Apply questions on this exam. Check out nursing roles and responsibilities during a disaster on page 1030. Pay attention to the bolded text. A utilitarian approach should be used when triaging during a mass casualty incident. Check out box 45.1 on home safety, page 1052. Numerous questions from this box. ABCs. What are they? Why do we use them? How do we use them? Page 1056 to 1058. Know the signs and symptoms and prevention for carbon monoxide poisoning, page 1064. Child abuse on page 1055. Domestic violence abuse, page 1054. Abusers characteristically have a low self-esteem. Table 44.5, page 1043. Anthrax. Focus on the transmissibility and the drug treatment. Endospores allow anthrax to survive and remain infectious for a long time. Treatment of ingested poisons, page 1063. Check out Table 44.1, the Disaster Triage System. Numerous questions on how you would triage patients based on this system, as well as this patient is in this type of situation with these symptoms, what would you triage them as? Which tag would you use? Frostbite treatment, page 1062. How to handle a choking emergency. You can see this on page 1066 to 1067, and you can also check out page 284 for a refresher. Skin care status post radiation exposure. Check out page 166. Fire safety. Look at the red alert box on page 1036. Check out the blue patient teaching box on page 1040. Know radiation decontamination strategies on page 1041. CPR on page 1067. How would you treat an unresponsive patient? What areas are evaluated during a primary survey? See the purple focused assessment box on page 1057. When caring for a patient with suspected physical abuse, you should always assess for the risk of immediate harm first. Poor role performance can contribute to risk factors for abuse. Elder abuse, page 1055. Index of suspicion. What is this and how do we use it? Page 1056. Living in a community filled with many abandoned homes could place a patient at risk for neglect or abuse. How do we care for patients with chest tubes? Refresh yourself on page 318 to 319. Nurses are mandatory reporters for what types of abuse? See page 1055, bolded text. Children who have no role models are at a higher risk for abuse and neglect. How do we treat dehiscence and evisceration? See page 95. What is critical incident stress debriefing and who is this for? Page 1049. Check out the red safety alert about a chemical disaster on page 1038.